Hal, thank you for joining us.
Thank you.
And looking back on your presidency, what was your most memorable experience serving as president of the ASDS?
We had a tremendous advertising campaign because my interest was always in communications. And so we spent $100,000 plus in order to tabulate a wonderful advertising campaign to tell the general public what dermatologic surgery was and what it was all about. And it was due to launch on September 13th, 2001. And so consequently, because on September the 11th, there was the fall of the Twin Towers, our advertising campaign was abbreviated, delayed, and really didn't reach the audience that we wanted to. Nothing reached anything for months afterwards. So it was a disappointment, but that was a very gratifying step forward. We had a professional advertising campaign in New York, put it together, and it was the start, I think, of good public relations for our society.
Yeah, it's built through the years thanks to that. What issues were facing the society in your presidency?
The main issue facing our society was, of course, the non-physician practice of medicine. And plastic surgery had lost the ability to do silicone breast implants. And they were therefore looking for anything they could to increase their revenue. So what they did was they looked to dermatology, and they tried to duplicate what we were doing research-wise, and they tried to go and do chemical peeling. They were interested in lasers. They were interested in fillers, anything they could to make up for that lost income. And it became a real battle between plastics and dermatology, especially at the AMA level. So that was probably the issue that was most important in my time.
Mm-hmm. Still important. And what were the most significant innovations in dermatology in that time?
I think during that time period, it was still the advancement of the CO2 laser. It was before the fractional laser had come along, but the CO2 laser was a very hot topic, and it was really quite good for us to be doing, which we did do and refine the way they were doing it, so we did it under local anesthesia.
Yeah, it was a big step. Let's see. Over your career, who's the most memorable patient you've had?
Well, to me, it was always a woman at Grady Hospital that was very wrinkled and very sun damaged, and it was the first phenol crotonol peel, which is a deep peel to remove wrinkles that we did on a charity patient. And the woman was very compliant, but she could no more have afforded that at all. And it really changed her life to have her wrinkles removed, all of her sunspots, and complete rejuvenation of her face done in a charity situation, which today would not be as financially feasible because even charity hospitals have to make money today. And our cosmetic surgery clinic has deteriorated, and it was the start of the cosmetic surgery clinic at Grady Hospital at Emory University in Atlanta, and we did a deep peel, and that patient was so grateful, and it is embedded in my mind more that than anything else.
Yeah, it's remarkable the difference you can make in someone's life by helping them feel better about themselves.
Exactly.
In looking back in your career, is there anything that you would change or do differently?
What would I do differently in my career? I would not have gone into dermatology, and I would have gone into acting, which was what I studied in college, and I would have made less money. I would have gotten gratification in a very different way, and if I had survived health-wise and had a long career in acting, I could have been very happy, a little less monetary, and I think that that's the most significant change I would have made.
Well, we are awfully glad as a society and as a country that you didn't make that change and that you went into dermatology and helped change what we do and advance the specialty.
Nice of you to say that. Thank you.
What advice would you give today's young dermatologic surgeons other than going into acting?
I would say to learn as many procedures as you can, to distinguish yourself from estheticians and nurses and non-physicians that are trying to camouflage the difference between all of us. So go and make yourself learn liposuction, make yourself learn deeper peeling, make yourself learn exotic lasers, and whatever it takes to distinguish yourself in a way that shows the professionalism of your training. I think that would be probably one of the main things I would do.
Solid advice. And what do you,
I would always say, I would also say, learn to publish at least once in your residency. If you don't publish in your residency, you're never going to publish. But learn to publish at least once in your residency, and that will give you the ammunition to publish something should something really dramatic come your way as a private practitioner or certainly in academics.
Barbara Gilchrist gave me great advice. She said, what you do in the first 5 years after your residency will determine the rest of your career. Same kind of thing. Get on it early and keep going.
That's right.
All right. What are your predictions for the future of our specialty?
I think that new advances and new innovations are important for our specialty, and we should be a part of them. And as long as we are a part of them, we'll advance as a specialty. But when those new innovations are taking the form of an individual who has a publicist who is working for those advances rather than for the advancement of dermatology, dermatologic surgery as a general rule, then they're missing the point. So I think as long as we can produce new advances in the right way, and as a society teach our individuals that they are obligated to promote these new advances and do industry advances to promote the society rather than themselves as a primary interest, then we would be okay.
Good. And what advice do you have for ASDS leadership in serving its membership in the future?
Well, to me, that's a simple question. I think they should go back to using dermatologic surgery instead of dermatology as a primary word. They're using it now as a secondary word. And that was a change that occurred probably, it occurred when Mitch Goldman was president, but it occurred, let's say, in excess of 5 years ago. So I would go back and incorporate dermatology and dermatologic surgery, let it come trippingly off the tongue, and let that be the way we promote ourselves instead of just we are surgical dermatologists.
Great. Hal, of all the things, we're going to go off script here for the last one, if that's all right. Of all the things you've done in your career, and there have been many, what are you most proud of?
I'm most proud of my textbook in chemical peeling, which was the first of its kind in 1992. And I saw its advancement go from a second edition in 97 and a third edition, which was paperback and available as the first ebook in medicine on Amazon, and now available as a free download PDF for developing countries, for residents, for anyone that wants it in 2017, so that that knowledge in peeling will be preserved for the future. And I think that is a legacy that I'm very proud of. I make nothing off the textbook at all, but it is available as a free download, and I think that's a unique thing for any textbook.